Good evening, everyone. My name is Hilly Haber. I am a rabbi and the director of social justice organizing at Central Synagogue in Manhattan. I am honored to be part of tonight's event. Thank you so much for having us. We are co-hosting tonight with One Day Sooner and the Rikers Debate Project. Rikers Debate Project, as you may know, does amazing work helping people who are incarcerated improve reasoning skills, which is critical for the process of reentry and return for life outside of jail or prison. Debate also promotes civic engagement and reasoned, thoughtful, and civil political discourse, as we will see here tonight. As you know, the topic of tonight's debate will be, should COVID-19 human challenge trials involving young, healthy volunteers take place with or without a rescue therapy? Human challenge trials in which volunteers are deliberately exposed to a virus are one method of potentially accelerating vaccine development and learning more about a disease. Adrian Hill, the director of Oxford's Jenner Institute, recently announced that his lab is hoping to be doing challenge trials by the end of the year. However, a COVID-19 challenge trial presents unique ethical considerations surrounding informed consent, acceptable levels of risk, and public trust in science. The NIH ACTIV group recently wrote that challenge trials should not take place until there is a rescue therapy that can reliably prevent mild symptoms from becoming severe. This debate, of course, is not to settle the question of whether or not challenge trials should take place without a rescue therapy, but to start a larger conversation with input from scientists, bioethicists, potential challenge volunteers, and the broader public about the subject. As I said earlier, I'm from Central Synagogue. Central is a large Reform synagogue in Manhattan. We host Friday night Shabbat services, which are being streamed now live from our sanctuary, and we'd love for all of you to join us anytime you want to check it out. Thank you so much to all of our Central audience members and participants tonight. I also have the pleasure at Central of working with our Central in Action team. We are an advocacy and organizing group. Our co-presidents are here tonight as well, Marihina Hosa and Sherry King. Most recently, we joined the College and Community Fellowship to help turn on the tap the reinstatement of the tuition assistance program for men and women who are incarcerated in New York State. We are so honored to be here tonight. Thank you for joining us. And I will now hand it off to Caitlin to give some background on the Rikers Debate Project.
Hi, good evening, and thank you so much to everybody for being here. My name is Caitlin Halpern, and I'm the acting executive director of the Rikers Debate Project, as well as the head of the Houston chapter. The Rikers Debate Project was founded in 2016 with teaching public speaking and critical thinking to currently and formerly incarcerated people, to give everyone a say in the decisions that affect their lives, and to empower people to advocate for themselves and their communities. We started in just one jail on Rikers Island, and over the past 4 years, we've grown to several classes in New York City, as well as classes in other jails and prisons in New Jersey, Connecticut, DC, New Orleans, and of course here in Houston. COVID-19 has transformed our program just as it's transformed all of our lives. Our in-person classes have been suspended since mid-March, but we're still going strong. For our formerly incarcerated students, we run a debate program via Zoom. And in addition to this event series about COVID-19 vaccines, we have an ongoing George Floyd debate series about defunding the police and the Department of Corrections. So far, we've partnered with Yale, Princeton, and Swarthmore, and we look forward to doing more in the future. For our currently incarcerated students, we run a correspondence course entirely through the mail. This allows us to continue providing educational services from afar and also provides a conduit of information between folks on the inside and folks on the outside. So we can provide reliable updates about COVID every week and learn more about the conditions in carceral facilities that are affecting our students' lives. To date, our student reports have been featured in the Houston Chronicle, the Marshall Project, The Appeal, ProPublica, and more. As much as the Rikers Debate Project has grown over the years, we remain an all-volunteer, grassroots-funded organization powered by people just like you. So if after tonight's event you feel inspired to volunteer or to donate, please visit us online at rikersdebateproject.org. We absolutely always need new volunteers, and we're currently trying to raise $15,000 to sustain our program through the end of 2020.
We wait for Caitlin to come back on. I'll turn it over to Josh Morrison to tell us a little bit more about One Day Sooner.
All right. So first, what One Day Sooner is, we're a group that advocates on behalf of people who want to participate in a human challenge trial for COVID-19. And so it's true that, we think that one of the things that people who want to participate in those trials are that they want to have the trials happen if they're going to be useful. But it's also, our position, it's a little more nuanced than that, because we think that by representing the voices of research participants, and particularly research participants for this, we can add uniquely to the ethical discussion. And just as much—
To the most esteemed Speaker of the House, guests of the House, and to my opponents, I want to take this opportunity to thank you for allowing me to bring the argument for why COVID-19 human challenge trials involving young, healthy volunteers should take place with or without a rescue therapy. To lay out our position, we already know how COVID has ravaged communities of color, underserved communities, and communities that have historically had less access to life-saving healthcare options. Why, look at it in my own hometown in the state of Texas, near the border of Mexico, COVID is decimating that community and bringing it to its knees. And as we wrestle with this notion of what's happening in our prisons, jails, and detention centers, how many lives have been lost, people infected and at risk of infection? How important do you think a cure is to them? How important is it a cure to their loved ones? Knowing that this disease affects the Black and brown community at the same rate mass incarceration does. That should give us pause. Enough of a pause to imagine that across the globe, the people who are most affected by COVID-19 are people of color. Oh, it's more than just about us. The data that we have access to leads us to our top line conclusion in support of our position, which is challenge trials get you more vaccines and better vaccines for the people around the world who need them most. There are 4 reasons challenges have developed the second generation of vaccines that the developing world needs, that this so-called first world needs. Now, firstly, according to the World Health Organization, there are 176 vaccines in development. Now, you can't get 30,000 person trials for all of them. You need challenge trials to prioritize which vaccines are most likely to work. Now, secondly, there are situations where challenge trials will be the only option to show efficacy. Now, as President Trump is pushing one vaccine that has been tested with a skinny sample, if you will, of people, how effective can that vaccine be? Moreover, once a vaccine is available, it can be very difficult to test other vaccines in conventional trials. I mean, who's going to be first in line to test for a vaccine if they said we already have one? Thirdly, many of the vaccines currently in phase 3 cannot be easily distributed in the developing world. Now, they can't even be delivered for folks in South Texas. For example, many countries cannot afford the cold chain distribution needed for some of the vaccines in phase 3, which need to be stored in sub-zero temperatures. Challenges allow us to take the wealth of the nation out of the equation. Now, finally, what is one life worth? What about 1 million lives? What risks are worth taking to save one life? How many mountains would you climb to save your loved one, your family? Let's scale that up. What risks are acceptable in the pursuit of saving lives? You know, we say these risks are reasonable. So far, 36,000 people have decided that that risk is reasonable, so much so that they signed up at the One Day Sooner website to participate in these challenge studies. As a matter of fact, as a matter of their individual liberty, they should have the right to make this choice if it is going to be medically beneficial, which it clearly is. The risk of challenge trials are meaningful, but they're likely to be lower than other risks we commonly let people accept, like kidney donation or childbirth. I want you to imagine once we reduce the way women are allowed to have childbirth based upon the risk of childbirth. The risk of death in a challenge trial would almost certainly be less than 1 in 10,000 and very possibly less than 1 in 100,000. It is true that there is uncertainty about long-term consequences, but these are likely going to be correlated with severe disease, according to a study in a Science about the French experience with COVID-19. The risk of 20 to 29-year-olds infected with COVID developing severe disease is 1 in 500. So back to the top.
The House thanks the Honorable Prime Minister and calls the Leader of Opposition, Camilla Broderick, to deliver the first opposition speech not to exceed 4 minutes.
Thank you. So the opposition is firmly against the use of challenge trials in creating a COVID vaccine at this time without the option of a rescue therapy. For our first point, the overriding issues that the challenge trials for a COVID-19 would violate ethical standards that have been developed over many decades to protect those participating in research, and also in reaction to unethical research studies such as the Tuskegee syphilis study. The Nuremberg Code Declaration of Helsinki and the Belmont Report lay out the specifics for ethical research involving human test subjects. In the broadest terms, challenge trials for COVID will be unethical because they directly contradict the physician's rule to do no harm. As well, the risks of the challenge trial are too great and volunteers cannot consent to so many unknowns. Even so-called mild cases of COVID can have long-term life-altering effects. Although the volunteers will be in the lowest risk age range, that does not mean there is zero risk. COVID can still be potentially deadly even to those who are young and healthy. The long-term complications are where things become even more difficult, as we just don't know how exactly it will compromise an individual's health in the future and what long-term medical costs will result. A German study published in the Journal of the American Medical Association found heart damage in 78% of patients examined who had recovered from COVID. 60% had ongoing inflammation. And even more disturbing is that this damage had nothing to do with the severity of symptoms, meaning it was common even in milder cases of COVID. 2/3 of those studied had mild symptoms and were not hospitalized. Frankly, we just don't know what other long-term health effects there could be. No one has had this disease long enough to know. We have no idea what recovery looks like a year, 5 years, 10 years down the line, and asking young volunteers to consent to risks that we can't currently comprehend is unethical. When the risks are unknown, consent can't be informed. Earlier challenge trials where volunteers deliberately were exposed to a disease had rescue therapies or extremely low mortality rates to ensure volunteers would be safe. We can't promise that and therefore should not engage in challenge trials. First, second point, challenge are not necessary because accelerated conventional trials are already taking place. Moderna has started their phase 3 trial. 9 vaccines are currently in phase 3 testing and 37 are in clinical trials on humans. Fauci believes we could have a vaccine as early as the end of the year. And challenge trials could take even more time since they need to manufacture the coronavirus and determine dosage. In addition, making a model for challenge trial could possibly take years. The scientific data we glean from the challenge trial is not enough to sacrifice people's lives. We can gather this data in other ways and through conventional trials without deliberately infecting volunteers. By only testing young and healthy volunteers, challenge trials are not inclusive to the population at large. It would bring data, but not the data needed for at-risk groups that are most seriously affected by this pandemic. As well, Moderna's trial recently showed that it induced immune responses in older adults as well as younger ones, proving it would help the population most dangerously compromised by this pandemic. Without a benefit that greatly outweighs the risk to volunteers' lives and long-term health, there is no reason to go forward with human challenge trials. And for our final point, a serious concern is the reputation of science and vaccine safety. If something were to go wrong and a volunteer were to die or be seriously injured, this could harm public trust in science and vaccines. Vaccine hesitancy and skepticism is already a problem. There are people who aren't sure, who are in the middle and could be swayed by unfavorable data or press. And without public trust, we can't reach a state of herd immunity that we need to move forward from this pandemic. And in response to challenge trials would adversely affect populations of color, this would actually exacerbate historical distrust of biomedical research by challenge trials only selecting people of color to be the base.
Grace.
Okay. Yeah, I'm sorry. I'll end.
The House thanks the Honorable Prime Minister and calls the member of government near Eyal to deliver the second government speech not to exceed 4 minutes.
Thank you very much. Can you hear me?
Yes.
Very good points, everybody. I'll do my best to address almost everything that was said by the opposition. The opposition started by allusions to Tuskegee and to the principle of do no harm. Tuskegee was not a challenge trial. There was no consent. It's nothing like what the Prime Minister is advocating for. We are talking about asking people to help us fight a terrible, terrible disease. What is more, pikuach nefesh, precisely because of what the opposition is arguing, that it's a terrible disease, that we have uncertain outcomes for not just, 50 people, 75 people, 150 young people in the trial, relatively at low risk compared to the general population, but the world population. Colleagues and I have tried to calculate, based on existing data in a very conservative way, what would be the benefit in humanitarian terms from accelerating in one way or the other vaccine rollout by just 1 month. The result is it's a development economist and a global health leader who helped me come up with that calculation, is that for 1 month, one would avert 720,000 years of life, and importantly, 40 million years in poverty, dire poverty according to the World Bank definitions, the majority of which is concentrated in the developing world. We're talking about an absolute humanitarian disaster, especially given how terrible this disease is. The opposition argued that in challenge trials, informed consent is somehow impossible. I happen to have written the main encyclopedic entry for philosophers on uninformed consent. I think that this is, and it's also in many publications, including some by other members of the opposition, it's a misunderstanding of the validity conditions for informed consent. If medical researchers in the 1990s did a study, and now we know that everything they told their subjects was false because that science progressed, we don't say, hey, that was battery. There was no informed consent. They did their best to convey what they knew, and that's good enough. That's what we expect. Here as well, if we don't know much, what we need to convey is, I'm sorry, we have great uncertainties. It might do great damage. Take it or leave it. If you want it, we need to make sure that people comprehend that. But this is it. It's not impossible to achieve informed consent for that. The opposition mentioned that challenge trials are somehow have become unnecessary because there are regular trials that are ongoing. Well, the group that is at the head of the PAC, Oxford University, has decided, as was mentioned earlier, that in addition to the conventional trial that it's running, it also wants to conduct a challenge trial because conventional trials can fail to reach statistically meaningful results before the disease goes to the next location. And they know that because it happened to them in England in the spring. That's why they're now testing in the US, in Brazil, in India, and in South Africa. So it can happen, and challenge trials would have a function even for the first generation and second, certainly for, as mentioned earlier by the Prime Minister, for second generation vaccines. It was mentioned that public trust would somehow disappear if there was a challenge trial. A lot of bioethicists have speculated about this. There is very little data on this. One piece of information comes from a deliberative workshop that was held in the UK, during which the public, after explanation, completely challenge trials. And the other piece comes from colleagues and myself, David Brookman and colleagues. We have work in progress where we did a global survey of nearly 6,000 people in 6 countries and give them different scenarios that correspond to different challenge trial types. The result is publics around the world are overwhelmingly happy to welcome challenge trials with the risks that we, I think, fairly describe to them to expedite this. Thank you.
The House thanks the honorable member of government and calls the member of opposition, Stanley Spinola, to deliver the second government speech not to exceed 4 minutes.
Okay, thank you. Good evening, everyone. My name is Stan Spinola. I'm an internist, a pediatrician, and an infectious disease physician who developed the human volunteer infection model in 1992. I hold an IND from the FDA, which is required for such trials, and I have supervised infection of over 400 volunteers. I participated in my model 3 times so that I could reassure the volunteers that the model was safe and write an accurate informed consent statement. As outlined by Ms. Broderick, it would be impossible to write a valid informed consent statement for a COVID-19 model as the long-term risks are unknown. 3 documents guide human subjects research. Because we are in a pandemic, these documents should not be violated. The overarching theme of these documents is to protect the right of the individuals from experiments that might benefit society but harm an individual. The Nuremberg Code, made in response to experimentation done in concentration camps in World War II, states that no experiment should be conducted where there's a reason to believe that death or disabling injury will occur. The Declaration of Helsinki states that physicians should only participate in research that safeguards the health of participants, and that the goal of new knowledge can never take precedence over the health of individuals. In Indiana, the risk of a COVID-19 infected 20 to 29-year-old being hospitalized is 3%. Their average length of hospital stay is 18 days, and 10% of those who are hospitalized die. Since there is no way to mitigate this risk, even if a volunteer consents, physicians such as me are bound to refuse to supervise such trials. The government stipulates that the risks are negligible. If we have learned anything from human challenge experiments, it's all about the dose. For any infectious agent, you can overwhelm the host by giving too high of a dose. For human challenge trials with the common cold coronavirus, the infectious dose was only 70 viral particles. If COVID-19 operates in a low and tight dose range, we could easily give a volunteer too high of a dose that will lead to higher morbidity and mortality than what occurs in natural infection. The Belmont report, a response to the Tuskegee syphilis study, includes respect for persons, which allows a person the opportunity to withdraw from research at any time. That is not possible in a COVID trial. It also includes beneficence, do no harm and maximize possible benefits. For those who participate in the setup of a COVID model, which would take about 50 participants over a 2-year period of time, there is no benefit. Since there is no benefit, the ethical standard for human models is that the disease must be entirely self-limited or there must be a curative therapy. Without this, such trials will not be approved by an IRB or the FDA. In 2001, the FDA halted influenza B challenge trials due to one person developing heart enlargement that was transient. If one serious adverse event occurs in a COVID trial, it would be shut down. And the damage to the credibility of the scientific community would be great, but the damage to the individual is more important. To demonstrate safety and efficacy, all vaccines need to undergo large randomized trials, usually involving 30,000 volunteers. 9 candidates are already in phase 3 trials. Clearly, human challenge trials have not been needed to accelerate this process. I urge those who want to participate in these experiments to volunteer for a phase 3 trial. Thank you.
The House thanks the member of opposition for their eloquent remarks. Now members of the audience have an opportunity to give 2-minute floor speeches. Does anyone want to give a speech in favor of government?
I'd like to give a speech against government.
Anyone in favor? Kyle, please.
Thank you very much. I appreciate the opportunity to speak on behalf of government in support of challenge trials. Firstly, this is the war of our generation. In generations before us, people have been asked to rise to the occasion, and many times by force, to fight on behalf of the people of their countries. This is our opportunity, volunteers, informed volunteers, to do just that. Innocent civilians are dying every day from the worst pandemic facing humanity since the early 1900s. There is nothing more that we can do, or there should be nothing less than doing everything we possibly can of our own volition to fight this virus. Thank you.
Thank you, Kyle. Gus, would you like to speak in opposition?
I got it backwards. I am for government, I guess. Sorry about that. Yeah, so basically, really my opinion, I'm one of the volunteers for the challenge trial. And I think that it's kind of absurd to say that there is an ethical, there should be some kind of ethical reason that I should not be allowed to consent to something like this, because, you know, obviously I understand the risks are not understood by anybody. The risk could very well be much greater than any other normal respiratory illness for somebody like me. Although there is no evidence to support that currently, that may be the case. It's absurd to say that I should not be allowed to choose to take that unknown risk because of ethical considerations, while on the other hand, saying that I must be forced to live with the risk of diminished opportunity, of diminished public health outcomes, of losing somebody that I actually care about, or, you know, even just not being able to see them or interact with them as much while they're still around, my elderly relatives. The fact that I should be prohibited from taking one risk and forced to take the other one is absurd. That's all I have to say.
Thank you. Do I have a speech for opposition? Or even two speeches for opposition? You can let us know in the chat if you'd like to speak. Brian will do off. Thanks, Brian.
Okay, so I came tonight having volunteered for the challenge trial and signed up for one day. But as I think more deeply about the actual ramifications of having these challenge trials, I think what I'm struck by is the difficulty of vetting potential vaccine candidates. And I think the analogy to past generations being drafted in war, in World War II, is a good one. But that doesn't mean that there is not owed to those who are volunteering a real care in terms of making sure that the risks being asked are worth taking. And I have to say, having sort of watched the process of various vaccine trials playing out, I'm becoming more and more skeptical that we do have the ability to vet which vaccines would actually be worthy of being subject to a human challenge trial. I'd sort of be interested in hearing more from some of the medical experts here, both for and against the measure being debated, about how they feel that process is going and whether we can get to a point where we are going to know with some certainty that these are vaccines that are worthy of having human challenge trials. So while not categorically against the proposition, I think as a potential volunteer, I would want very clear evidence that the trial was indeed well-grounded.
Thank you, Brian. Avi, would you like to speak on behalf of the op?
I think if S. Smoller wants to go instead of me, I think that'd be great. But thank you.
Am I on?
Yes.
Oh, okay, thank you.
Thank you.
I'd just like to make a comment. It depends on whether the challenge trial is 2 vaccines against each other, or whether the challenge trial is for a placebo versus a vaccine. Because one of the major principles of the ethics of clinical trial are if there is equipoise. And equipoise means not that you individually, but that the scientific community estimates that the efficacy and the risks are in balance. That is, they're equal among the 2 treatments. So if you don't know how a treatment works, you're ethically, as the principal investigator or as the scientist leading the thing, that's okay. But if you are already convinced that it works and the other one doesn't work, then it is not ethical to do such a trial. On the other side is the issue, well, it's not on the other side, it's on the same side. I'm echoing what someone else had said before, and that's one of the major principles in these kinds of medical ethics is autonomy. So each person is assumed to have the autonomy to make their own decisions. So those are just the 2 comments to take into consideration in that kind of a situation.
Thank you. The House thanks our floor speakers and calls on the closing speaker for opposition to sum up the op case, reminding them that new examples are welcome, but new arguments are not. This speech is not to exceed 3 minutes.
It's Greg. It's not me.
Okay, I wasn't able to unmute myself earlier. Okay, I want to start by saying I was very, very impressed with the passion of the government's argument, but not so much with the logic. I think I want to start by saying this is not like people opposed to challenge studies are not in favor of COVID-19. So I understand the passion. We all have this passion. We all hate this pandemic, and we've all been adversely affected or seen people adversely affected by it. We all want to see it end. So the issue isn't whether one side wants the pandemic to end sooner than the other side. The issue here is really, do challenge trials make sense? And I'm going to argue in support of Ms. Broderick's and Dr. Spinola's points that they don't. So first of all, the entire impetus and assumption behind the argument in favor of human challenge studies is that they will result in bringing a COVID-19 vaccine to market more quickly. However, as the opposition has persuasively noted, there is no reason to believe that this is the case. It can take up to a year to develop a COVID-19 pathogen that is sufficiently stable and consistent to be used in a challenge trial. As Dr. Spinola, who's a researcher who's done human challenge studies for over 20 years, noted, the regulatory process for approval of a challenge trial can take years. Even if a challenge trial passed these 2 hurdles, and there's no reason to necessarily believe that they would, and showed efficacy, there is no way to adequately demonstrate safety in a human challenge study. If you have a single study with 50 participants, you cannot demonstrate safety. So demonstration of safety, as Dr. Spinola pointed out, will still require the equivalent of a large-scale, double-blind, placebo-controlled trial, largely indistinguishable from a traditional phase 3 clinical trial. It's the only way to determine adequate safety. And the standards and the bar for safety for vaccines are very, very high. It's not much higher than for most medical treatments. So human challenge COVID-19 vaccine trials will likely take as long or longer perhaps than the current accelerated phase 2, phase 3 trials already being implemented. And given that they won't probably reduce the time to vaccine approval, or there's significant doubts of that, and there's no justification at this time for pursuing human challenge studies. Even if the development was accelerated, which it won't be, the dangers associated with COVID-19 vaccine human trials clearly violate research ethics guidelines that have been developed over the last 70 years. Guidelines that were developed in response to research that's caused terrible harm to research participants. No challenge trial has ever been done with a pathogen for which there is no treatment. And if a participant were to get seriously ill with COVID, or even with a mild case, any trial would have to be stopped. And in the situation of serious illness, there will be enormous financial and psychological costs that would not be covered by the research, potentially lifetime health costs. I'll just stop there.
Thank you. The House thanks the closing speaker for op and calls on the closing speaker for gov to deliver the final speech of the round, not to exceed 3 minutes.
All right, thank you. Thank you for the opposition for giving their arguments. I would like to point out that yes, the distinguished gentlemen who gave the arguments have talked about the Belmont report, the Nuremberg Code, and like ethical standards we have used in the past. But I think one overarching theme of this is a new situation. So in a sense, we have new standards. For example, a year ago, if you would have said to any scientist, any vaccinologist, we're going to develop a vaccine in 12 months, they would have said, no, that's absurd. Like that's impossible. But like given the current pandemic, we have we see that the vaccine process is accelerated at a pace no one thought was possible. So in the same way, challenge trials, there are two things to take from the new situation. We need new standards to adapt to this new situation. And we're not throwing out the old standards completely. The things in the Nuremberg Code, the Belmont report are still great, but we need to adapt them to the situation. So for example, when we have respect for persons, we want to give them informed consent, and we can think about what does informed consent mean? You give the volunteers the best information that you have, and then if they consent to the risk, then it's fine. And one thing that the opposition said is that challenge trials will take a year or longer to conduct, but we're already in the process of that, and they would only take a year in the same way that a regular vaccine would be developed in 4 to 5 years. Sure, under normal circumstances, that is true, but like we can do a challenge trial even faster. So I think the first point I'd like to make is just that this is a new situation, so we need new standard, or not completely new standards, but we need to adapt to the situation in the same way that our regular phase 3 vaccine trials have adapted to the COVID crisis. And the second point I'd like to make is like why challenge trials are worth it. The opposition said when the risks are unknown, consent can't be informed. But people take unknown risks all the time, higher than a coronavirus challenge trial. For example, service workers such as firefighters or kidney donors have a higher chance of death than a coronavirus challenge trial volunteer. So in that sense, we think that we can give a kidney donor can give informed consent, even though there's a high risk of harm. In the same way, a challenge trial can, volunteer can. And also, if challenge trial volunteers don't take this risk and we don't do challenge trials, we're imposing the risk on everyone else. So the opposition mentioned a hypothetical situation where the reputation of science could get hurt, where a challenge trial volunteer could die. Those are incredibly unlikely scenarios. And the challenge trials can help second-generation vaccines, as we have said, which will most likely be distributed to lower income countries. So sacrificing a almost sure thing for speeding up second generation vaccines for an improbable hypothetical scenario is not reasonable in my opinion.
Thank you, Isaac. We will now wait a few minutes for the judges to make their decisions on the round. In the meantime, the audience can cast their votes with this Google form that I'll post in the chat right now. As a reminder, each judge will have 1 vote, and the audience collectively will have 5 votes. Let's begin hearing from our judges. Sherry King, how are you voting tonight?
I am voting with the opposition. And my reasons are that, first of all, I think that the history that brought us to the ethical standards are very important cautionary tales, and that there is a speed and so many questions in the current context about maintaining ethical standards that I think that should be a concern. I think that the fact that there are already, as people mentioned, accelerated phase 2 and phase 3 trials suggests that the benefit may not be worth the risks. And I thought that the opposition presented a very strong factual case, and that I think I was quite interested in the nuances of what informed consent is, and even understanding that it does feel to me that there are safer ways in an ethical context for us to get to the same end.
Thank you, Sherry. Catherine Auerbach, how are you voting tonight?
I'm also voting for the opposition. I thought there were a lot of really great arguments tonight, and I was sort of going back and forth throughout the whole debate because I thought everyone made really great speeches. I thought I was going to vote for government at one point, which was like just like in the past, informed consent, how like the point about how informed consent is like whatever information there is at the time. I thought that was a really good counterpoint to the opposition's sort of idea of there is no informed consent and that sort of whole point. But at the end, what really swayed me over to vote for the opposition was Dr. Zemet's point about how is there even really a need to have these trials at the time when it's going to take so long. That it felt to me that the risk for putting these people at risk in terms of giving them this, giving them COVID with the potentially useful vaccine is not worth it if we already have a vaccine in the mix. So I'm voting for opposition.
Thank you, Catherine. Moses Silverman, how are you voting tonight?
I come to this with a blank slate. I have no opinion about this coming into this, and I now have more questions than I have answers from listening to these presentations. So this is not based on what I actually think, because I haven't figured that out. But based on the debate, I am for the opposition. I am very impressed by the passion of people who want to do something to get us out of this crisis and who are willing to risk their lives to do that. And I really respect that, and I'm impressed by that. But I was not persuaded that we understand sufficiently what that risk is, that we can allow people, and that doctors who have professional obligations to save lives can put people into an unknown world where the risk is not clear. And I think that was kind of conceded. It's true that we ask people to take life-threatening risks all the time, firemen, soldiers, policemen. But as I understand it from this debate, there are standards beyond which we cannot go when we do not know what will happen. And the potential consequences to the people taking the tests and to the bigger picture of our desire to get the solution to this problem, I'm not persuaded by the government that what they propose is likely to work and is an appropriate risk to take.
Thank you, Moses. Mari Hinojosa, how are you voting tonight?
Wow, we are a risk-averse group. I am also in favor of the opposition, but for a slightly different reason. First, I want to commend all the speakers on an incredible job. That was a job very well done. I was very, very impressed with the arguments, and like Moses, I came to this as a blank slate. I found many of the government's arguments very compelling, particularly the argument about the disparate impact on communities of color, the ability to get more and better vaccines faster, and the argument that the risks relative to organ donations and childbirth in firefighters are relatively small. However, in the end, I was most persuaded by the opposition, first because in the face of so many unknowns and no rescue therapy, which would be an unprecedented type of trial to not have a rescue therapy, that informed consent would not really be possible and that it would be unethical. But really the argument I think that persuaded me the most is the opposition argument that this would pose a grave risk to public trust in science if anything were to go wrong. And I feel like, we are at a time when there is a lot of skepticism and that it could be truly disastrous if this were to be accelerated and we would lose the public's faith. I think the repercussions would be quite dramatic. But this was really food for thought, and I really want to thank everybody for a stimulating and exciting debate.
Thank you, Mari. Dr. Peter Bach, how are you voting tonight?
Uh-oh. Okay, there we go. All right, I'm unmuted. Thank you. Well, first of all, I really appreciate both the passion, but also the seriousness and the studiousness of the debaters on both sides of this issue. There were a lot of facts, a lot of references to seminal documents in the sort of pantheon of human subjects research, and a lot of very fair characterizations, I think, of the crisis as we're in. I am going to also vote for the opposition, however, for several reasons, all based on the points the opposition made or the government failed to make, in my view. The point the opposition made that the disease is just too poorly characterized, I think hits home here, that it would not be possible then to construct an informed consent process that met the criteria for informed consent. The argument that even though it feels like a serious crisis, and it of course is, and we all are deeply concerned about it, the notion that to do challenge trials without a rescue therapy discards some basic principles, I think requires the government to make a much stronger case that discarding those principles has merit here. I didn't think that the case was made that this situation was truly different enough to rethink the last 100 years of human subjects research protections that have been put into place after many missteps. And I wasn't compelled that analogies to people taking other sorts of risks, such as kidney donation or becoming firefighters or conscripts into military action, had analogies, not because there aren't other examples of people voluntarily or through government action taking risks, but instead because it doesn't cut to the heart of how the medical establishment plays a role in human experimentation and the obligations that carry with that very asymmetric power structure that was referenced by the opposition, I thought, very effectively.